Hello, my name is Bagus Putra from Industrial Engineering 11 Maret University. I'm here to present the result of my research, the effect of health warning labels on intention to repurchase cigarettes in Surakarta city using structural equation model method. Author Bagus Putra, Lobes Herdiman, Susi Sumartini, and Taufik Rahman. Outline: Introduction, Method, Result and Discussion, and Conclusion. Introduction. Behavioral problems that are often found in various strata in Indonesian society are the addictive behavior of smoking. Indonesia is a country with the third highest number of smokers in the world after China and India. In 2015, Badan study, Indonesia accounts for more than 230,000 deaths from cigarette consumption each year. Saying health cases due to smoking that still need a lot of prevention, using efforts to the marketing cigarette products to increase intention to quit smoking. Namely, anti-smoking campaigns in the mass media to the obligation for cigarette manufacturers to include tobacco package warning labels or health warning labels on cigarette packaging. The application of health warning labels on cigarette packs aims to reduce the prevalence of smoking. The Indonesian government already has a policy in the form Government Regulation number 109 of 2012 concerning the safety of additive substance in the form of tobacco products for health, which was released in 2014. This is various of health warning labels in Indonesia. The percentage of residents aged 15 years and over who smoke in Surakarta city in 2020. This data indicate the Surakarta city has problems regarding smoking behavior in every productive age. According to Hamdan 2015, one of the factors that indicate the problem is the ineffective application of health warning labels on cigarette packs. Sukarna research 2014 that intention to repurchase cigarettes in the main goal because in previous research on warning labels it was found that smokers prefer to reduce the number of cigarettes consumed rather than stop smoking. The approach to solving the problem using the partially square structural equation model method. The determination of variable for the study is the development of the model theory of plant behavior TBP ASEAN 1991. Method. The stats in the study are based on previous research from Pairing to 2021, be adapted to the needs and context of the discussion. First, determination of variable operation. Based on ASEAN 1991, the formation of intention is the TPP model is directly influenced by attitude towards behavior, subjective norms, and perceived behavioral control. The addition of variable is done to further reinforce the cause of the intention to repurchase cigarettes. The addition of tobacco package warning labels variable based on Tamariki Research 2015. The addition of perceived risk of smoking variable based on Acton Research 2018. The addition of socio-demographic variables based on research by Xu et al. 2015. The population and research sample study was conducted in Surakarta city with the main respondents are smokers. The spread of online questionnaires using social media, while the spread of questionnaires offline was done by interviewing a directly smoker encountered. Data analysis technique or the first outer model testing include convergent validity, discriminant validity, average variance extracted, and composite reliability. The second, structural model measurement or inner model. Result and discussion. The implementation time is 3 weeks on 22 May until 12 June 2021. Respondents are said to be valid if they meet the requirement. The total respondents obtained were 219 respondents, but only 201 response that meet the requirement for data processing. Result testing of SEM model, result of intention to repurchase path analysis iteration 1. Evaluation of outer model iteration 1. There are several indicators that have a loading factor value of less than 0.5, namely D1, D2, D4, D6, D7, PC1, PC4, PS1, PS4, and TL4. So this indicator variable must be removed in iteration 2 data processing. Indiscriminate validity for non-liker value and cross-sliding value, indicator D2, PC1, PC4, and PS4 have a smaller cross-loading value than the other latent variable, so that this indicator variable must be removed in the iteration 2. Average variance extracted atau RAV, based on the AV value in table, the latent variable socio-demographic, perceived behavior control, and perceived risk of smoking have a value of less than 0.5. Composite reliability and coarse band alpha, socio-demographic and perceived health risk variable is not reliable. Result of intention to repurchase path analysis iteration 2. Iteration 2 convergent validity shows there are no more indicators that have a loading factor value of less than 0.5. The result discriminant validity iteration 2 for non-liker value and cross-loading value. The result obtained are all the indicator variable value for latent variable are greater than the correlation value between other latent variables. Average variance extracted or AV. There is no latent variable that has an AV value of less than 0.5. Composite reliability and crossband alpha. The socio-demographics variable has a value of less than 0.6. The lack of this value means that the socio-demographics variable is not reliable. Evaluation of intermodel. In this study, the R-square value was 0.258 for the intention to repurchase construct. It can be concluded that the 6 construct have an influence contributing of 25.8% of the intention to repurchase and are said to have a weak influence. Meanwhile, the R-square value of the construct of attitude towards smoking is 0.528. These results can be concluded that the two constructs have an influence contribution of 52.8% and are said to have a moderate influence. Meanwhile, the R-square value of the perceived behavior control construct is 0.38. This result means that the two constructs have a contribution of 38% influence and are said to have a weak influence. Hypothesis testing. Hypothesis testing uses the statistic and p-value. If the p-value 0.05 or alpha 5% is obtained with t greater than t table, namely 1.96, it can be concluded that the result is significant, or hypothesis H1 is accepted. From hypothesis testing, hypothesis H5 and H6 are rejected. Discussion. Based on this study, the variables attitude towards smoking, socio-demographics, subjective norm, perceived behavior control have a direct significant effect on the decreasing intention to repurchase. Then the variable tobacco package warning labels and perceived risk of smoking have a significant indirect effect on the decreasing intention to repurchase. Meanwhile, subjective norm variables that are indirectly related to intention to repurchase are rejected. S5 and H6 because it does not have a significant indirect effect on the intention to repurchase. It can be concluded that the health warning labels circulating in the city of Surakarta influence the intention to repurchase cigarettes based on significant variable from the same test. Conclusion. Factors that have a positive significant effect on decreasing intention to repurchase, namely attitude towards smoking, socio-demographic, subjective norm, perceived behavior control, perceived risk of smoking, and tobacco package warning labels. Thank you. Finally, it's over. I hope this research has some benefit to us. I'm sorry if I did some mistake during the presentation. Thank you for your attention and see you.